Health officials are sharing more about a tuberculosis outbreak in Kansas.
TB caused by a bacterium that usually affects the lungs. It spreads through the air when someone with TB coughs, speaks, or even sings. So how do you deal with it? Fox 4's Hannah King working for you with live near the University of Kansas Health System 39th and Rainbow with some answers. Hannah.
Well, I'm told that from health officials, the risk is very low. Now, as of Friday, January the 24th, there were 67 active cases in the state, 60 in Wyandotte County, and 7 in Johnson.
Some of you are aware we have and still have mobilized staff and resources addressing an unprecedented tuberculosis outbreak.
In a Senate committee meeting on public health and welfare last week,
Currently, Kansas has the largest outbreak that they've ever had in history.
an official with KDHE says the CDC is supporting efforts to address an unprecedented tuberculosis outbreak.
CDC remains on the ground with us.
Ashley Goss, the Deputy Secretary of Public Health, says the KDHE has a goal to bring an end to this TB outbreak.
We still have a couple of fairly large employers that are involved that we're working with on this. We do expect to find more, but we're hoping the more that we find is latent TB, not active, so that their lives are not disrupted and having to stay home from work because it is highly contagious.
There are people who do have contact with tuberculosis because maybe somebody was sick and coughing in the air around them and they had then inhaled that bacteria and they get TB infection.
Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control with the University of Kansas Health System, says the risk is low.
TB infection, 90% or more of people who get infected with TB don't ever have symptoms. And they're what we used to call latent TB, but now it's called TB infection. The people that then otherwise, the 10% or less that develop tuberculosis disease, is mostly what people are familiar with, and that can be a public health emergency or problem.
And some of those symptoms include a prolonged cough, night sweats, and maybe some weight loss. And those symptoms could last for a few weeks or maybe even a few months. But Dr. Hawkinson also goes on to say it's vital and it's very important to know who has this disease and who their contacts were so they can prevent it from spreading.